This is the Educare module on mobility with focus on exercise and ambulation. Hi, my name is Nicole Rennie. I'm a physical therapist and geriatric certified specialist in physical therapy. I'm going to be your facilitator today. I've been in private practice for over 14 years and a physical therapist for over 20. I'm extremely passionate and dedicated to keeping seniors stronger.
I'm Jean Howell, and I will be the co-facilitator for this module. I have more than 35 years' experience as an RN working in assisted living, home care, and clinics.
We're going to have two separate learning objectives. The first will be in regards to ambulation. We're going to talk about how to walk with a client who's either using a walker, cane, or no device, how to properly adjust the height of a walker, learn where to stand when walking with the client, and then just review some basic habits that caregivers do. The second set of learning objectives is going to be in regards to exercise. We're first going to review some general information regarding aging and what happens when older adults actually lose their leg strength as they age. We're also going to discuss what effective leg strengthening actually is and some options for older adults to help improve and maintain their leg strength. When walking with a client, a transfer belt should always be used. A transfer belt is a necessity for safety for the client and for the caregiver. Strongly suggest that a client always wear shoes with walking. The shoes allow the client to be more steady on their feet and reduce the risk of sliding. The best type of shoes is something that has a good heel support and a non-slick bottom. One walker does not fit all clients. The height of the walker should be adjusted and checked to fit the client you are currently working with. A walker that is too tall causes a client to lean forward more, and one that is too short can cause them to fall. Prior to starting to walk with the client, set the destination or distance you want the client to walk. This will give the client the visual to see the end. Many of us like a challenge and to achieve goals, so setting the destination will help set up the client to be more successful. This is the incorrect method for using a transfer belt. Notice how the elbow is up in the air and the palm is facing away from the client. In this position, the caregiver does not have a lot of strength in their arm to help control the client if they should lose their balance. This arm position places both the caregiver and the client at risk of injury. This is the correct method for using a transfer belt. The transfer belt should be tight around the client's waist. The caregiver's hand should come up from the bottom with the palm facing away from the client. This grasp allows the most security for the client and the caregiver. It also allows the caregiver to keep the client close to them and support them if needed. Remember, the transfer belt should be snug. Remind the client that when they stand up, the transfer belt will loosen a little bit, but it needs to be very snug and seating. This bent arm position with the palm facing away from the client allows the caregiver to have the most strength in their arms. We're now going to talk about determining the proper height of a walking device. Have the client stand up as straight as they can, with emphasis on keeping their knees and their back straight. Find the bone on the client's wrist, which is on the pinky side of their wrist. When the client is standing upright, that bone should line up with the top of the walker or cane. When this position is achieved, the client is standing upright and their elbows are almost straight. The straight elbow position allows the clients to have the most support in their arms and helps them walk safely. Again, when the client is standing upright, the bone on the small side of their wrist should be in line with the top of the walker or cane. We're now going to examine some incorrect walker heights. We're first going to look at the photo on the left side. The walker is adjusted too high. The bone that is on the client's wrist is set way below the height of the walker. When the walker is placed too high, you'll see the client pushing the walker away from them and bending to get their elbow straight, which causes them to bend at the waist. The picture on the right, the walker is set too low. Again, notice where that small bone is on the client's wrist. When the walker is too low, the client also bends at the trunk to keep their elbow straight. We're going to talk about where the caregiver should stand when walking with the client. Standing at the client's side is the most common place to stand. This is the ideal position when the client needs help moving the walker or cane. When walking at the side of the client, you have one hand on the transfer belt, and the second hand is free to either help push the walker or support the client if needed. So let's talk about when the caregiver should stand behind the client. When the client needs moderate to heavy support of their body weight, or the client has a history of knee buckling, or the caregiver feels that they need two hands on the transfer belt, they should stand behind the client when they're walking. This is often the position you also see people who are shorter than their clients. If the client is very tall and the caregiver is short, oftentimes the caregiver feels more comfortable walking behind the client with two hands on their transfer belt. If the client needs help propelling or pushing the walker forward, a second caregiver may be necessary. When caregivers are walking with clients, it might be necessary for them to give the clients cues or directions on how to improve their walking. It's very important that the caregivers use slow, short phrases, and that these phrases might be repeated several times throughout the entire walk. Some common phrases are lift your knees. Lifting your knees helps the client take longer steps. Notice that I said lift your knees and not your feet. It's a lot easier for a client to lift their knees to take longer steps than to lift their feet. Remind the client to take long steps. They don't realize that their steps are actually short, so reminding them to take long steps is a great way to increase the speed and the length of their walking. Remind the client to stand tall. Standing tall encourages the client to stand up taller and actually helps with their walking. Walking bent over is very difficult. It's also very important that we encourage the client to look up. Looking down at their feet when they're walking actually increases their risk of falls. So again, the cues from the caregiver should be short. We should speak clearly and slowly. And the cues may need to be repeated multiple times throughout the walk. Here are a few things for the caregiver to consider prior to walking with the client. When the client is first stood up from the chair, have them stand there for a count of 2 or 3 to make sure that they're steady on their feet. This time also allows the caregiver to readjust the walker or the tightness of the transfer belt. Walking in a straight line is actually easiest for older adults. It's much harder to turn the walker, so if you can set them up in a path where they walk in a straight line, they're going to be more successful in their walking. Avoiding doorways, turns, and sharp corners also help with walking programs. It's also best if a walking program can be completed in a quieter area of the facility. Also remember that it's difficult for the client to walk and talk at the same time. So try to limit the amount of conversation that you're providing with the client. You can remind them that you can talk after the walk is completed, but you need to focus on the walking. If the client is stopping and starting during their walk, the caregiver may need to help the client by helping push the walker forward. This is best achieved when the client and the caregiver are walking side by side. If a client has memory issues, I strongly suggest that you help propel the walker forward to keep the client moving. Remember, it's better to ask the client to pick up their knees versus pick up their feet. The cue to pick up your feet actually increases the length of their steps and helps them have better balance. Also ask the client to look up and not at their feet. Have them look for that destination chair that you set out previously. Encourage the client to stand and rest during the walk rather than sit down to rest. It is okay to have them stand and take a few breaths and then continue on with the walk. We need to improve the endurance and the length of time that people stay on their feet. So have them take a few breaths and then continue the walk.
Let's look at the procedure for walking with a client using a walker before we view the video. First, communicated with the client what was going to occur. Number 2, used a transfer belt correctly by coming up from the bottom with the palm facing away from the client. Number 3, client wore shoes. Number 4, had one hand on transfer belt at all times. Number 5, encourage the client to stand for a few seconds prior to walking. Number 6, placed hand on side of walker to help client move forward if appropriate. And 7, gave directions to client, short phrases, spoken clearly and slowly. Continuing the steps of the process, number 8, use terminology lift knees rather than lift feet. Number 9, encourage the client to stand and rest and then continue walking rather than sitting down to rest. Number 10, stood in appropriate place to walk with client, at the client's side if minimal help is needed, and behind the client if more assistance is needed. Number 11, encourage the client not to look at the feet. 12, set a distance goal for the client. 13, adjusted assistive device correctly. Number 14, did not encourage client to converse during walking. And 15, remove transfer belt when completed.
Okay, Leona, we're going to go for a walk.
Okay.
So the brakes are locked. I want you to scoot your tush forward. Good. Lean forward. I need your feet to come back. Lean all the way forward. Keep bending at the waist. Keep bending at the waist. Keep bending and push. Grab onto the walker. Now I just want you to stand here for a second and catch your breath before we start walking, okay?
Okay.
Now we're going to go for a walk. Here we go. Lift those knees and look up. Good job. Here are some things that are not recommended when walking with the client. The first is that the caregiver should never walk backwards. Walking backwards places the caregiver at risk of injury. It also means that the caregiver does not have one of their hands on the transfer belt. And also, when the caregiver is walking backwards, they're not going to be able to see objects that could be in their way and possibly cause them to trip. Supporting the client under their arms or holding the client's upper arms when walking with them is not appropriate. One hand should always be on the client's transfer belt, and the second hand should be helping to propel the walker or have it be free to assist with balance. Grasping under the arms or holding the client's upper arm causes injury and bruises to both the caregiver and the client. Using two caregivers to support the client when walking is not usually recommended. Using a walker actually reduces the strain on the caregiver because the weight of the client is going through the walker and not through the caregivers themselves. Clients tend to trust the stability of the walker over the human being. Therefore, I recommend that the client use the walker for stability, but two caregivers may be needed for balance or to support the person's weight. Caregivers, it's very important that you notify nursing if the client's walking distances are becoming shorter, the client is requiring more support when walking, they're complaining of pain when walking, or the client is becoming short of breath while walking. These are all signs that a medical change may be occurring. It also may mean that the client needs a modification to their walking program to make sure you and the client remain safe. Now we're going to talk a little bit about aging. You may be surprised, but we start losing strength at the age of 30. A typical 70-year-old woman would have 50 to 70% less strength than she did when she was 30 years old. This is why older adults start having difficulty with walking and transfers as they age because they're losing the strength in their legs. However, this is a reversible phenomenon, and we'll talk about how this can be done later on in the presentation. Let's talk about some of the specific things that occur as people lose leg strength. Again, as a reminder, we all start losing strength at the age of 30. So what does this mean for older adults? I also want to point out that a certain amount of leg strength is required for a person to be independent with their mobility. If they do not have enough leg strength, these are the things that occur. They have an increased risk of falls. They're going to need help with their transfers. So if a person doesn't have good leg strength, they're going to need to be lifted. They're also going to have difficulty climbing stairs. You need a certain amount of strength in your legs to be able to climb stairs. And if you've lost strength due to aging, you're going to have difficulty climbing those stairs. If you see one of your clients who's bent over, shuffling their feet, can't pick up their feet, this usually is contributed to having muscle weakness in their legs. Many people are also surprised that the speed and the power of movements also is affected when people lose strength in their legs. And the biggest thing about muscle loss in a person's legs is that you need to use a walker. If a person has weakness in their legs, they need to use a walker to help keep them safe with their walking. So think about the clients that you interact with. We think that they're having falls and having difficulty with transfers because they're getting old. It's actually because they're losing strength in their legs. I want to share some more interesting facts. This should shed some light on why older adults have difficulty with walking and transfers. Think about your clients that you interact with, the ones that have just finished their Medicare PT. When they're done with their exercises, they're typically stronger, have better balance, can walk better. Unfortunately, 30 to 60 days later, you start to see that person slide backwards again, and you're wondering why. The reason is that a person can start to lose strength just 3 to 5 days after strength training is stopped. If you or I strength train and we take a break, we can still get out of chairs, walk, do exercises, but older adults sometimes are so close to not having enough strength to complete those activities that when strength training is stopped, they begin to slide backwards. Another interesting fact is that 1 day of bed rest can cause 6% muscle loss. This is equal to 1 decade. To me, that's kind of scary that if I'm ill and I spend 1 day in bed, that I've lost so much strength in my body equal to a decade. This is why so many older adults who become ill and need to spend time in bed end up going to the hospital and nursing home and oftentimes not returning to where they were living before. The good news is that 2 decades of strength and muscle mass loss can be reversed by engaging in a lower extremity strengthening program for at least 2 months. So as a caregiver, why is this important to you? Why do you need to understand how leg strength affects you and your job? As I talked about earlier, a certain amount of leg strength is required for a person to be independent with their transfers. The less leg strength the client has, the more work you're going to have to do. But thinking differently about why clients are struggling can actually help you in the future. Keeping a client stronger, especially with their legs, allows them to be independent with all of their mobility. Caregivers play a huge role in keeping clients stronger. Now we're going to talk about what effective leg strengthening is. There's lots of misconceptions. Some of the basics is that it needs to be progressive. That means that if you do the same exercise with the same weight and you're not challenging the person, they're not going to get any stronger. Effective strengthening means that you're building specific muscles that are related to fall prevention and mobility. For example, improving the strength in a person's arms is not going to help them with their walking, but building the strength in their legs will. There are oftentimes some misconceptions about strength training. If you're just lifting the leg up and down off the bed, that is not strength training. That is called range of motion. It's really important that we're stimulating the muscle by challenging it, and this is most effective when cuff weights are used. Strength training also needs to occur at minimally 2 times per week. We touched on it earlier that a person begins to lose strength 3 to 5 days after stopping. So if the exercises and strength training is completed 2 times a week, they will maintain the strength that they currently have. Research has showed that when older adults are able to complete lying down exercises, either on the bed or the floor, with 4-pound weights, their function improves. Now we're going to talk about some misconceptions regarding strength training. Many of these things are going to surprise you. Walking, swimming, and biking are not effective strength training. You need a certain amount of strength to be able to complete these activities, but once you're able to do them, you're not going to gain any more strength in your legs. Think of it this way. If a person is weak, they have difficulty walking, they can't bike, they can't climb stairs, and they can't swim. To be able to complete those tasks, the person would have to do leg strengthening. Another misconception is that clients over a certain age cannot get stronger. I will tell you personally, the oldest person that I've ever strength trained with was 111. We're not trying to turn these people into fantastic elite athletes. We're trying to get them strong enough so they can function independently or with the least amount of assistance. I can tell you that any diagnosis, whether the person has Alzheimer's, Parkinson's, aging, have had hip replacements, they can get stronger. There's no limitations on any diagnosis that would stop a person from getting stronger. So what options do clients have for effective strength training? Many of them will rely on you as caregivers to assist them with this process. The most common option is a home exercise program with leg weights. This is best completed if the person is lying down. There are really only 4 exercises that need to be done in the legs that target functional benefits for older adults. The best part is it only takes 10 minutes 2 times per week, but the client needs to be self-motivated. We talked earlier that when a person is able to complete these 4 exercises with 4 pounds, their function will improve. Another option is a group seated exercise class with leg weights. Unfortunately, the leg weights need to be greater than the ones that use with lying down. This is basically because you're not getting the same amount of movement as you would with the lying down exercises. The best part about the group exercise class is you have the encouragement of your peers. Another exercise option is that older adults can go to a gym. Many of us go to the gym ourselves to work out. Think about the activities that we do, and then think about your clients that you assist with. I would bet that most of them could not participate in the activities that you do. Firstly, most older adults can't use this type of equipment because of their immobility. Also, the machines at a gym do not target the muscles that prevent falls and keep people independent. Plus, this generation has never been to a gym before, and it needs to be self-motivated. That is why I think the gym, again, is a great adjunct, completing the home exercise programs discussed earlier, and the gym can be used for the aerobic and the endurance component. Another exercise option is for an older adult to work out with a personal trainer or a private pay physical therapist. Even though the older adult needs to pay privately for the service, the programs can be customized to suit their needs. With either of these options, the older adult can work out in a gym setting or in the comfort of their own home. Here are a few important things to point out in regards to exercise and walking with older adults. Remember, it's essential to assure that the walker or cane is set at the proper height. Direct the client to lift their knees rather than to lift their feet. This will help them walk further, take bigger steps, and be safer on their feet. And the most important thing is that everyone, no matter what age, diagnosis, can improve their leg strength. And it's essential to keeping their mobility and having their quality of life be the best it can throughout their years.
We'd like to thank you for your time. Please ask your RN if you have any questions. When you are ready, please complete the knowledge and demonstrated skill assessment.